How long have you been a cardiologist, Dr. Sen?
At AdventHealth is 24 years, almost 25.
Okay. Dr. Sen, what percentage of your patients are Asian?
About 3% of my total patient volumes are Asian.
And are there patients that don't speak English? And if so, how do you handle it?
If they speak Chinese, either Mandarin or Cantonese, I speak both of the dialects, no problem. But if the Asian patients speak non-Chinese, we have translator. It's a very convenient app on the video.
Okay. And
Real-time translation.
who brings them in to translate to? Their kids, or tell me?
Oftentimes, they're younger generations, if they can find time off work, or their friends who are the same generation. English is still limited, but they want to have someone else to understand the history and the medical information.
There's also a nurse, Bianca. Tell me a little bit about this nurse. What does she do?
Well, I have this wonderful Chinese nurse. She was born and raised in Hong Kong. She's been a RN in US for decades, and she's been working with me side by side for 16 years. And she works full-time helping Chinese patients in their native tongues. She speaks both Mandarin and Cantonese, and she has her phone number shared with the Chinese patients and their families, and they can contact her anytime, nighttime, weekends.
And when did you decide that you needed help? What happened to you? And
Right, so I've been working here for almost 25 years. For many years, I gave my cell phone number to Chinese patients who don't speak English, and they can access me anytime. But when I had ovarian cancer in 2007, and that was a metastasized cancer, and in reality, I was off work for only 9 months, but that was the time I believed that I need to have help and to serve my patient better. I decided to hire a full-time nurse. All of the patients have access to her.
how does it make you feel knowing that you are helping the Asian patients coming in who don't know any English?
It's really rewarding. Often they have family members who really want to know the details, but they have a hard time to get the usable information from the patient themselves. And I can fill in the gap. And for the patient themselves, they feel a lot more comfortable, because even for someone who speaks fluent English, disease itself sometimes can cause the kind of anxiety that affect their expression, have more of such trouble if they foresee the challenge ahead of them in terms of language and culture.
And where are you from?
I was born in China. My parents were born in Hong Kong. I went to Hong Kong first and then to America. So I've been in the US for 32 years.
And tell me about your family. Like, who inspired you to be a doctor? And tell me a little bit about the family and the doctors.
I am the 8th generation doctor in my family. So my son is a doctor too. He's a 9th generation. My father is an orthopedic surgeon. So when I was young, I would always go to the OR or go to the clinic to watch him. And in those days, in 1980s, there are patients coming to our home too. The patients from villages, they could not get the transportation to get to the city during the 9 to 5 o'clock to see the doctor in the hospital. They would come to our home at nighttime after they get off the bus, and I would observe how my father explained the disease process, and a lot of them involving rehab. So I'm very active in the cardiac rehab too. I know that treating acute illness is one phase, and the recovery is a lengthier period and involves a lot of help from the family member.
You talked about helping others in the community. You participate in major trend, dragon boat races too. Tell me a little bit about that and why.
All of us, when we get sick, we get tremendous medical help from the doctors and the healthcare professionals, but we live in a community and our friends and families that can help them heal, prevent progression and relapse of diseases, and have a overall better quality of life and help their well-being.
In China and in America, is there a big difference?
Setup of the healthcare system is different. In China, they focus a lot in acute care. They may not have the spread of the primary care physician in the community. At least they don't have that kind of density. But of course, in America, for non-emergent situation, they often have to wait for a few days or even weeks, sometimes months, to see a specialist. But at least for the daily ailment, they have someone to speak to. Now with the electronic medical record, if patients use patient portal, it's even more convenient. And at AdventHealth, the patient portal is so easy to use.
I know there's a big difference between Chinese medicine, the East and the West, right? Chinese more herbal. Tell me compared to the West, which is like real drugs, right? There's a difference?
I would say the difference is if you talk about the modern healthcare in big cities in China, they have that too. It's just that the distribution of per capita is not as broad as US. If you talk about the traditional Chinese medicine, they're still playing a very important role in mainland China now. A lot of patients subscribe to the concept of traditional medical theory, like the qi or massage acupuncture, moxibustion. In US, those are categorized as alternative medicine.
I guess when you think about how far you've come, right, from being the daughter of a doctor in China to now being a cardiologist at a huge hospital and being part of the community, tell me how it all makes you feel and your goal in life.
Yeah, the setting of healthcare is different, but caring for individual patients are really similar. You answer their questions, you try to analyze what is ailing them from their symptom. In that aspect, it's really similar. What I learned from my father is tremendously important. But because the system is different, we navigate a very complicated maze sometimes dealing with the insurance company or the payer system. We, as a physician, unfortunately, we spend a lot of hours outside of direct patient contact. And that actually plays a role in doctors' burnout too. But that's another topic.
I love watching you today speaking to the patient on the bed.
Yeah.
It almost looked like you really comforted him. Tell me about that a little bit. When you're talking to them in their native language.
Today, we were doing a procedure. And before today's procedure date, I had a detailed discussion with the patient already. But that is outside of the equipment, outside of all the healthcare people in their gowns surrounding them. The environment is completely different. I want to talk about the procedure in the current environment, but in a soothing tone and very relaxed way so that they're not afraid of the machinery around them.
So that's what was going on when you were talking? You guys were going back and forth?
Right. I realized that he asked very similar question as we had talked about, but it's not that he's forgetful. The anxiety change people perceive things and affect their recall of knowledge. I just take time to explain to him, and I can also point to the machinery, emphasizing comfort.
It almost seemed like you were talking to a family member. Is that what it's like when you talk to someone in Chinese?
Yes. It's interesting how language changed your way of thinking too. When I speak Chinese, I think like a traditional Chinese person. And I would call them uncle. American medicine, it's hard to imagine. A doctor will call the patient uncle or auntie, but I do that. How we treat senior person, I call this patient uncle. More relaxed. When you wear a coat or scrubs, of course, that's necessary for medical care, but actually that is almost like a costume to separate you from the patient because you are playing a role. And they think you're just part of the big system, a big machine. But when you call them uncle and auntie, and they feel that, oh, okay, this is almost like a niece, my nephew.
You had mentioned 8 generations of doctors in your family. Did it go way back, even before your dad?
Yes, I actually had the chance of observing my grandfather practice. And in their generation, it's traditional Chinese medicine. And without the laboratory's help, without imaging study, they're more history taking, and the follow-up is more detailed, because you don't have the study to go by.
So you got to watch your grandfather, then would that be your grandfather got to watch his grandfather?
Yes, and it's almost like an apprenticeship in the family. That's the tradition. In those generations, they don't have schools to go to learn medicine. So it's in the family. So a lot of herbal formularies are in the family.
Standards here at AdventHealth compared to what your dad?
The standard of AdventHealth, keep me safe, it's the same theme as what I learned from my father, because we as physicians offer what we know about the disease process, the prognosis, diagnosis, and the management plan. But at the end, it's the patients who will make the decision. And that's a pretty heavy burden. And you need to make them feel that whatever they decide, you will walk alongside them and keep them safe. There's things that they think is risky. Actually, it will serve them the best. But it will take time for them to accept that potential risk of the therapy that eventually will give them the best quality of life and prognosis. And that concept of keep me safe goes a long way, learning from my father. Take time to discuss the difficult decisions with patients because it's their decisions to make. I'm there to help.
Your dad was a doctor. His dad was a doctor. Does that mean his dad was a doctor?
Yes, before my father's generation, all the physicians in the family were male. And starting my father's generation, my aunt was a physician like my father. So the first generation going to medical college to get a formal medical education. Both my aunt and my father learned from my grandfather when they were young.
When you had family gatherings, did you guys talk a lot about medical stuff?
Oh, yes. When my father was still alive, when my sister's also visiting once a year in my home, and there are 3 Dr. Sen together, and their friends coming to visit. And when they ask Dr. Sen, we don't know which one they're asking, but when they ask the question, then we know, okay, that's a cancer question will go to my sister, orthopedic will go to my father, and heart will go to me. We talk about medicine a lot, especially medical ethics.
Knowing that you make a difference in the lives of Asian American patients, what's that like?
So rewarding. They have different family dynamics. When I talk about serious illness, I have a slightly different approach. Talking to Asian population, many of them need a very soft approach when you talk about a disease or condition with poor prognosis. And I would take time and speak to the family member, because sometimes the family member would think that's such a gravely serious topic that they create distance from the patients, and the patients will feel lonely because they know someone's hiding something from them. I would need to explain to the family member to ease their nerves so that they will be there to truly support the patient. The love is there, but the fear of the disease sometimes make the family member a bit distant, and I want to do more in that area to help.